So, timing of local therapy. When should we do it if we do it, right? And the focus here is on folks where we might want to be a little bit more aggressive when there's just a few spots. So, there's upfront treatment and treatment later on. For upfront treatment, it can prevent problems at high risk sites. It's best if spots can be treated safely and quickly. Downsides are it may delay or prevent receipt of medicines, and things may spread further without the appropriate medicine. So we can boost the mileage of medicines with local therapy. When we treat early, we can reduce the amount of cancer and improve the duration that you may be on a specific medicine. Sometimes we also treat later on. Pros of this is that we ensure the receipt of medicines known to improve how long people live, and it may shrink areas too high risk for local therapy up front. So it helps for me to feel more comfortable to maybe give a little bit extra radiation, and I'd feel safer doing that if it was maybe half as big as or a third as big as it originally started. The downside is there might not be benefit if the medicine isn't as effective or there are no more medicine options. So it's a balancing scale. Medicines alone may be convenient with less adverse effects, but local therapy could possibly introduce additional adverse effects. So once the spot starts growing, we can do deferred radiation or local therapy to take care of the spot so you can continue the same medicine. And we still don't know if it's better to switch the medicine or add local therapy and stay on the same medicine. It's highly dependent on each patient. So does the spot go away after radiation? Let's talk about following up after radiation. Radiation works slowly over time. This is before, high precision radiation. 3 months later, it looks like a scar. And here I'd start to sweat a little bit, and where we see a little bit of increasing consolidation it's growing a little bit as compared to this scar. Now, short-term CT is what I would order, not a PET CT here. And look what happens over time. Again, 95% of the time, like the long-term local control is durable with effective doses. And so this is a reassuring pattern to me. It might look like gobbledygook, but I've looked at like thousands of these scans before, and we see this scar tissue all the time. And just because there's scar tissue, it doesn't mean the cancer is active. So understanding scans after treatment, the PET may look bright for many months after radiation, especially in the lung. That's why I personally like to avoid PET CTs within 6 months after lung radiation, unless it's necessary, or we're looking at spots outside of the lung that didn't just receive radiation. It's important to correlate follow-up imaging with where and when and what dose was delivered, and your radiation oncologist will help interpret scans so we may avoid unnecessary worry or treatment changes.